And we can get started. So we're calling our subcommittee to order, the Preventative Care Subcommittee of the Women's Health Commission. And I think this is an opportunity for us, as the chair asked us, to gather and identify what are some potential areas that we would recommend that the Women's Health Commission focus in its work. And I think extending through the 2026 calendar year. And so would love to open it up for ideas. I'd like to start by saying I think preventative care can be thought about in a couple of different buckets, and just lift up an idea that actually Madison had shared with us, just to be able to have the discussion around, like, the way I think about it is like regular checkups with the doctor, and what that in both insurance coverage looks like for women in Virginia and for vulnerable women, as well as if there's good data that DMAS has to show for us, given coverage for women in the Medicaid program and such. So kind of there's that aspect of it. And I know there's also other specific um, illnesses that we would want to discuss how we can help look at preventative care for that. So I think I will start there. I get echoing to myself. So maybe it is to have DMAS come, and thank you so much, Madison, for that idea, to come and share with us data around how women under the Medicaid program are accessing general well checkups and such.
I agree on with you on that. I've also been taking a look at the youth and making sure, like, doing their regular checkups once they hit like um, menstrual cycle age, that they're actually getting like real reproductive health services checkups, and asking those questions to probe them about what needs to be done. Do they have any like symptoms of anything, just to make sure that we're screening them properly. And then also ensuring that pediatricians, check in with the moms and say like, hey, have you had your postpartum visits, and things like that. I think it's things that we can tailor.
Great, thank you. I think also, if we're going to have DMAS come and talk about kind of coverage and services that women in Medicaid are accessing, is there a way for us to connect with other insurers around, you know, just coverage? What is the insured rates, and are there data that shows how women are accessing, well checkups and annual exams and things like that outside of Medicaid?
I believe that is something that we should take a look at, as
Mhm.
well as the I found the sleep apnea really, really interesting, and I would love to have something like preventative care, models of, like, how do we make sure that we're asking the right questions, and our providers are asking the right questions? Because I've started asking different providers, like, "Is this something that you were aware of?" And the answer was no. And so, using that report and that data to create something would be great.
Great. I like building on one another. I think we were both also in the Aging Gracefully subcommittee.
Yes.
So I think that there's some overlap there too, right? Preventive care around osteoporosis.
Mhm.
Um, and is that connected to, for example, other well checkups that we should be going on? And I'm realizing I'm not following that advice myself, but like how how are the conversations around osteoporosis, around breast cancer and other cancer screenings connected back to those exams or those checkups?
Something I was looking at the other day was breast cancer. And younger people are starting to find out that they have it. But when you look at all of the resources and the data, they're more tailored, or they tell you, okay, you can wait till you're 35, 40 to start to really do these screenings all the time. And that we just are doing like the regular touch, feel examinations, but making sure that they really understand, like, especially with the changes with the environment and the food. I think that making sure that the younger groups are well informed could definitely be preventive care so that if they do have it, it's found early.
I like that. Natalie, I see you popped on the screen. We'd love to hear any ideas you have as well.
Oh, yeah, am I off mute?
Yes, we can hear you.
Oh, okay. I was just sitting here thinking maybe addressing some social determinants of health, like housing insecurity, transportation, food access, workforce conditions, and some deal with the lack of paid leave. Uh,
Mhm.
that it's, accrued an hour per whatever their paid leave policies are. Um, More digital access, maybe for because not a lot of providers offer, I believe, a good amount, but not all, telehealth services and online portals, especially for those on Medicaid. Um, to reduce as many structural barriers as possible. And with the preventative care for the Asian population, I think we kind of spoke on with Senator Locke the chronic disease management, cancer screenings, breast cancer,
Mhm.
colorectal. I think it was also cervical. We
Mhm.
talked about fall prevention for our older um, or aging populations. I got to stop saying older. Bone density, things like that, that are a little more thoughtful.
Did you capture all of that, Madison? That was a good list. Awesome.
Oh.
Oh, yes, I did. I'm writing them down, Madam Chair.
Thank you. I wanted to get back to some of the cancer screenings and as it relates to vaccinations as well. And I know that vaccinations for our kiddos are such a big topic, but vaccinations, as it like, I was thinking about like is it the HPV
Mhm.
vaccine, right? Can help be a preventative measure, is a preventative measure for later on, as because I know we were saying that we're looking at kind of the perimenopause age through our seniors. So, but as HPV might affect, vaccine might affect health later on, but also vaccinations that some of our older adults get as well, um, and how that fits into the preventative strategy.
And as it relates to perimenopause, menopause, um, creating something where we're looking at the cortisol levels. I know with Black maternal health, Black women are known to have higher cortisol levels, which create them to go into weathering. And so looking at that, because that can also affect what that experience of menopause is like for them, and everyone else who's experiencing it. So I think creating something that either looks at the levels, evaluates them, and coming up with a plan. Because even the underserved populations, they can't necessarily afford hormone balancing medications or anything like that. So having DMAS take a look at that to see, is it covered? What could we implement?
I think building off that, just kind of the whole all the things that go into perimenopause and menopause. And it's not that we can ever prevent going through those
Right.
stages, right? But how can we ease like all the things we need to be thinking about to ease the experience?
Is it possible that we can, I don't know, incentivize not just the physicians, providers, but also the insurance companies and Medicaid to do employer partnerships?
Mhm.
Um, that can, I don't know, the VDH, data dashboards, is there a way to look at, Medicaid data or, data in general with the insurance companies if we do insurance and employer partnerships to track preventative care usage, maybe by the region, by using race, age, income, things like that?
I think that's a good idea to
Mhm.
explore.
Yeah, to see what data is available, what does it show us? I think it would be good to also look at, um, like, incentive programs that get at preventative care. So, both my parents are on Medicare, and part of their coverage is they get a little bit of an allowance every quarter to, um, purchase things that are like, extra vitamins and floss and other things to take care
Mhm,
of, your whole health. And
mhm,
then I know that there are employers and also companies, employers that engage in those types of programs. So just building off on what you were saying about employer partnerships, Natalie, if there are ways that we can look at how those incentive programs, you know, what their uh, impact is on health.
and going back to the regional aspect of it, our rural, areas of Virginia that have, care deserts, I believe we used to have mobile units, mobile vans, and the funding for that years ago fell through. Is that something that we can look at getting back? You remember what I'm talking about, Kathy?
I
Yeah, I
remember
think so.
when we had those, and I think now the funding has gone to, I know it's pilot mobile units, but I don't know if it's specifically for maternal health. But I do know that maternal health has pilot mobile units that they are starting,
Mhm,
and I believe it starts this. I think they started looking at it in July
mhm,
to come up with those. But I think that that would be good, and I know a couple of, MCOs do have them, like Centera has a mobile unit, Aetna has a mobile unit, but I'm not sure, if how often they're going into those rural areas.
but
Mhm.
not just for maternity care, I mean,
Right,
just
this
in
is,
general.
they do, like, all the screenings.
Yeah,
So Sentara has their own, I know Aetna has their own, and that's where they go and they do all the screenings, I think they call it wellness day or something of that nature. But it's for
Mhm.
everybody, it's not just geared toward maternal health. The other ones that came out in the budget last session was just for maternal health. But I think the MCOs, like, are covering their own.
mhm,
I also wanted to bring up, like, in the aging process, what are strategies to help lessen Alzheimer's, dementia, and other memory loss illnesses. So, for example, the ability to hear, right, is really the inability to hear is really tied to social isolation and can also higher prevalence of dementia. So, like investments, and I say this is like I've been trying to get the state to invest in hearing aids for adults in the Medicaid program because then an investment upfront can help later on lead to better health outcomes. So for our notes, like what are steps that we should be taking to address, um, kind of the expected and anticipated increase in dementia and other memory loss disorders.
do we have, a plan to address cuts to Medicaid under the ACA that most recently came down from the administration?
I think that has been a big topic as we kind of start brainstorming the budget priorities.
Yeah, yeah,
Yeah,
hmm,
for the House and the Senate.
yeah.
All right, well, I think it seems like we have a very broad and long list. Would it be helpful if Madison helped recap for us to see if there's anything missing?
Oh, Madam Chair, I can certainly do that. I'll just go down the list of what we have here. So first off, we talked about just addressing issues for the youth and making sure that they're able to get proper checkups for puberty and proper screenings, as well for moms and postpartum visits. And then we also talked about having DMAS come to possibly present on different strategies for coverage and services, on also data on how women are accessing checkups. And then we also talked about as well for DMAS addressing different steps in the anticipated increase in memory loss disorders for aging populations of women. Let me see, we also have addressing the social determinants of health, especially for women in the workforce, and also addressing a lot of those economic barriers as well, and paid leave policies. And also addressing digital access to telehealth, and also chronic disease management and fall prevention for aging populations as well. And then also talking about cancer screenings for HPV, as well, especially, and vaccinations for older adults, and fitting those into the preventative strategy. Um, and then we also talked about creating screenings for cortisol levels, and looking into the insurance structures, especially for is DMS covering those different experiences, as well, and perimenopause and medications that can help with those issues. And then also looking into how we can ease the experience of women that are experiencing menopause. And also looking at assisting providers and insurance companies to engage in employer partnerships. And is there a way that we can also look at gaining access and looking at that data through different dashboards as well? And then I think one of the last topics was looking into rural Virginia healthcare deserts, and seeing the funding for some of those pilot mobile units, and also looking at, I guess, different insurance companies as well, so Centera, and Aetna, and how often they are going into those rural areas and providing that access through the medical units.
Cool. Are there any other ideas that we want to put out there that we haven't covered? It's a very long list. But I think it falls in a couple of buckets, right? Like there's the maternal health aspect, reproductive and maternal health care. There is, and then things very specific to aging, as we have to look out for as women who are aging, and then also kind of like a bucket around data and what that tells us in terms of care that people are accessing now and how we can do better across all of our communities. All right, cool. All right. Is there anything else? Looks like we might be good. All right, I'm going to give you all back some time on your calendar. I appreciate the brainstorming and look forward to when the full commission meets and we can talk about all these good ideas. Awesome.
Y'all had a good holiday.
Yay.
Hi,
Thank
everyone.
you.
Thank you.
Care. Have a great start to December.
Thanks.
The Senate of Virginia, Richmond, Virginia.